So I want to begin this episode by acknowledging that I am not an expert in this topic, nor could I ever be, because obviously I am not a Black woman, but I felt like this is such an important topic that I wanted to start discussing it. And if it is something that you are interested in, I highly recommend continuing to do research, figuring out how you can support positive change with the maternal health crisis for women of color in the United States. And I'm going to be providing a list of suggestions in the show notes to help us all figure out how we can do more to support, again, positive change in this area. So I first decided that I really, this is something that I needed to start researching more. I needed to go deeper into when I made a video last year about dying during childbirth, where I mentioned how incredibly rare it is to die during childbirth in the United States. And a Black woman left a comment saying that, she's like, dying during childbirth in the United States isn't as rare for women of color. And she was absolutely right. It is shocking that according to the CDC, Black women, American Indian women, and Alaska Native women are 2 to 3 times more likely to die from pregnancy-related causes than white women. And the dangers really seem to be the starkest for Black women. And I've read that Black women are actually 4 times as likely to die during childbirth, during pregnancy, or in the first year after the baby's birth than white women. And this figure is even higher in certain areas. For example, Black women in New York City are up to 12 times as likely to die during pregnancy and childbirth than white women. And income and education levels really have little impact on pregnancy and birth risks for women of color. There's celebrities like Serena Williams, Meghan Markle. They've reported that they were not taken seriously when they reported various concerns to care providers during pregnancy. And then this is one of the saddest stories. I don't know if you've heard of the mom, Kira Johnson, who died soon after childbirth. And so the story with Kira is that she reported severe pain in her abdomen shortly after a C-section, and she started to shake. She grew pale. She even had blood in her catheter. And even though her husband repeatedly told medical staff at the hospital and asked for their help and asked them to figure out what was going on with Kira, she did not receive care for 10 hours. And when she was finally taken into surgery, when they finally realized that something was wrong, there were 3 liters of blood in her abdomen because the doctors had accidentally cut her bladder during the C-section, and she had been internally bleeding ever since. And she died on the operating table. And sadly, just like Kira's death was entirely preventable, 2 out of every 3 of these deaths are also preventable. The primary complications that often lead to these deaths include cardiomyopathy, which is a disease of the heart muscle that makes it harder for the blood to pump blood to the rest of the body, and it can result in heart failure. There's thrombotic pulmonary embolism, which occurs when there's a clump of material like a blood clot that gets wedged into an artery in the lungs, and this can block blood flow. Hypertensive disorders, which are related to high blood pressure, and postpartum hemorrhaging, which is excessive blood loss. In addition, C-section rates are often higher for Black women than white women. And as we saw with Kira, C-sections can have big risks, especially when your post-operation concerns are not taken seriously. So, while this is a complex issue, one of the causes of this disparity is implicit bias in the healthcare setting. And implicit bias is when we have, certain attitudes towards people and associate them with certain stereotypes, usually without being consciously aware of these biased perceptions. And this implicit bias, it can result in care providers kind of just brushing away the concerns of Black women specifically during pregnancy and childbirth and not believing them when they think that something is wrong. And this can lead to substandard care, serious issues not being properly addressed in a timely manner. It can be really damaging. And understandably, it can also make women feel invisible and completely, unheard and incapable of understanding their own bodies. So, it's no surprise that the CDC reports that many pregnancy-related deaths are connected to Black women not having access to appropriate and high-quality care, a missed or delayed diagnosis, and in some cases, lack of knowledge in pregnant women and their care providers about warning signs of certain complications. And there's a lot of studies that suggest that, 60% or more of pregnancy-related deaths could have been prevented if these issues, were properly addressed. Another major issue is that Black infants, horribly, are twice as likely to die as non-Hispanic white infants. And many of these deaths are caused by, congenital abnormalities like heart defects, neural tube defects, or Down syndrome, in addition to complications from preterm birth. And preterm birth, this is an especially big issue that often stems from structural racism in healthcare settings, which, means that Black women often receive poorer quality care in these settings than white women. And sometimes these women are even denied care and often not treated with the dignity and respect that they deserve. And it's also been found that Black babies often receive lower quality care after birth, especially in NICU units, than white babies. So with all that said, it's really not surprising to hear that, studies have found that the stress caused by this racism can cause something called weathering. And weathering is a chain of biological responses that negatively impact a woman's physical and mental health. This then makes her more susceptible to pregnancy complications. And of course, Black women, they're often experiencing some level of racism in almost every other setting that can exaggerate the stress that they're under during pregnancy. And another factor is the bombardment of messages women get from the media about, their higher risk for a variety of health issues. And this issue is not helped at all by the fact that many medical schools still teach, fallacies rooted in racism. So for example, they sometimes teach that Black women have a higher tolerance for pain, or they're less educated than white women. And this can impact the care that care providers give them. So some suggestions that have been made by health experts, for shifting this major issue include improving health programs that largely serve communities of color, like Medicaid, the Children's Health Insurance Program, eliminating something called maternity care deserts. And what these are counties where there is no access or limited access to maternity care. meaning that women that live in these maternity care deserts don't receive proper maternity care or have to travel really long distances, sometimes at significant cost, to seek adequate care. Another potential thing that can help is building a more diverse workforce in maternity care. I think this is a big one, specifically creating programs to support Black women in becoming midwives and becoming OBGYNs. And this can lead to more culturally competent healthcare. Addressing racism and implicit bias in maternity care is crucial. Getting Black women better access to mental health services, and above all, what needs to happen is that the healthcare system needs to acknowledge what a major issue racism can be in the care that they provide to Black women and their babies. Racism in healthcare it's so serious that the U.S. Centers for Disease Control and Prevention and the American Medical Association has labeled it a public health threat. That's how bad it is. And one small win, a little win in California was the passing of the California Dignity in Pregnancy and Childbirth Act. And this act, it aims to reduce pregnancy-related preventable death, serious illness, and associated health disparities by addressing bias in the healthcare system. And this act requires healthcare centers provide perinatal care, or centers that provide perinatal care to offer an evidence-based implicit bias program for staff that provide perinatal care. And they also require that they have to do a refresher course every 2 years. And the course that is taken, it has to cover unconscious bias and misinformation, power dynamics, impact of historical oppression of minority communities, and local perspectives on provider-community relations. Something else that has been a step in a good direction, the March of Dimes. They've trained 15,000 healthcare workers in how to acknowledge the many ways women of color are treated differently and learn to change the harmful practices. And then there is the Robert Wood Johnson Foundation. They have an initiative where they have women of color share what respectful care would look like for them. So this information can then be shared with hospital staff. What a novel idea, right? Asking the women that are receiving this poor care what it would look like to have better care. Let's go straight to the source and ask them how we can do better. And then on a big scale, there is the Black Maternal Health Momnibus Bill. I hope I'm pronouncing that right. And what this is, it is a set of 12 bills that would coordinate and fund federal programs that ensure that all pregnant people have access to housing, transportation, food, quality health care, and other essentials during pregnancy and beyond, into motherhood. And there's a really great nonprofit, I'm going to include this in the show notes, the Uzazi Village, UZAZI Village. And this is a nonprofit that works to increase maternal and infant health for Black and Brown communities. They also employ doulas who help to advocate for Black mothers in medical settings. And again, these are all very, worthy organizations, initiatives to support. They'll all be listed in the show notes along with other ones, because I do think that this is a crucial issue. Even if it does not impact you directly, this is something that I believe we should all be upset about, and we should all be making moves to change, because every woman, every baby in this country deserves to feel and be safe during the process of pregnancy, childbirth, early motherhood. And it is not okay that so many women of color do not feel safe.